My name is Nico Reinsch. I'm also working as a clinical electrophysiologist in the Alfried Krupp Hospital Essen. It's in Germany. It's a great pleasure to present some aspects of how to reduce the workload in your clinic when using remote monitoring and implantable cardiac monitors, also called implantable loop recorders. So for two reasons, I really would like to focus on ICMs. First, as you can see, the diagnostic value has increased over years in comparison to external Holter monitoring or external loop recorders. Second, in 2018, the ESC guidelines have expanded the indications for implantable monitors to certain genetic disorders. And for that reason, there are each year more and more patients receiving ICMs, all of which have to be actively managed. And this is creating much more workload for everyone involved in our clinics. As you can see, there are currently about 6 devices commercially available on the market. And all these in the current generations are getting smaller. They are easier to implant and they have much better diagnostics. And all of them, as you can see, are capable of MRI and, of course, of remote monitoring. A significant challenge of rhythm surveillance of these loop recorders is that there's a high volume of clinical data transmitted. As you can see here, in a study comparing the Reveal-Link and the Confirm RX monitor, the incidence of false positive transmissions was between 46 and 86%. And of course, this adjudication of these transmissions requires a lot of time for each clinician to analyze these episodes. The primary causes for false positive were, on the one hand, undersensing, and on the other hand, premature atrial and ventricular ectopy. So within the next minutes, therefore, I really would like to share some aspects of how to reduce these false positives and, of course, to decrease the workload in your clinic. First, undersensing. The device is implanted extracardiac, and this leads sometimes to a loss of capture between the sensing electrode of the device and the muscle tissue. This can lead to variation of the R waves, as you can see here, and as a temporary undersensing as a consequence. For example, after postural changes of the patient, or even in very obese patient where you have a very bad contact between the device and the muscle tissue. As I've shown you in the previous slides, the devices are getting smaller and smaller. This is also what the patients require if you demonstrate the different systems to the patient. The BIOMONITOR system has a much longer vector in comparison to the Reveal-Link. It's about 2.5 centimeters longer. And as a consequence, you have a much higher signal amplitude, and we have demonstrated in our own data that the amplitude of the signal is very stable. As you can see here, after the implantation and after 3 months is even increasing. And in comparison to the other devices, again, the Reveal-Link and the Confirm RX device, you can see that the signal amplitude is almost doubled. As a positive side effect of a stable and very high R wave amplitude, you have a very low noise burden. Noise burden is a fraction per time during which the device cannot be evaluated, the rhythm, and this is mostly due to electrical interference or muscle potential. And as you can see here, in this case, the misclassification or even the level of noise was about 2%. Using the BIOMONITOR, you have, besides the long vector, you have a fractal coating of the device on the base and on the tip, and this also stabilizes the noise level about less than 1% after 4 weeks, and this is a quite good result. And of course, this also can lead to an easier and quicker rhythm classification. For me, as an electrophysiologist, clear P waves are very crucial to analyze the rhythm, for example, when analyzing atrial tachycardias or atrial flutter. And in this case, I want to show you an example of a patient with atrial flutter where you can come to a quick diagnosis when analyzing this ECG. And in the second loop here, it's an irregular AV conduction, and without having these clear P waves, you probably might be unsure if this is atrial fibrillation or if this is atrial flutter. Another example in a patient with unknown syncope, as you can see here, a clear P wave, and a non-conducted P wave to the ventricle in case of an AV block. And this is a patient who requires a pacemaker implantation. And without the P wave, you might be not sure if this could be an atrial block or if this is an AV block. As a fourth point, I already showed you that ectopy might guide you to the wrong diagnosis and might misinterpret an AF episode. And about 52% of episodes are false positive due to premature ectopic beats. And as you can see here, there are polymorphic ventricular ectopy. And on the upper right, in the Lorentz plot, you can see the very irregular conduction. And this might be misinterpreted as the start of an AF episode. So there's a new algorithm, and this algorithm is called rhythm check. And this algorithm might reduce, without losing sensitivity, the reduction of false positive of about 72%. And this is quite high. Beside, and I think this is very smart, there's an ectopy counter in the device. And this allows you for a trend for the last 240 days to count your ectopy. And this also might guide your therapy in patients with symptomatic PVCs, for example, if this is a patient, for instance, for an ablation or antiarrhythmic treatment. Finally, the programming of the device is very important. We highly recommend to adapt the programming on an individual basis. For example, in this case, for a patient with syncope, or of course, if you have a patient with atrial fibrillation, the patient's characteristica should be programmed more on an AF basis than on a syncope basis. Second, most of you are familiar with sensing thresholds, for example, in ICDs with T-wave oversensing. So you also have the opportunity to optimize the sensing settings. In this case, there are several examples to reduce oversensing in your device. Last but not least, all current guidelines recommend symptom ECG correlation. And for that reason, additional inputs can be provided using the patient apps. There are a couple of information, for example, vital data. You have the status of the last successful data transmission. You see if there's still enough battery in your device. And you have the symptom diary. So let me conclude. To my opinion, high sensing quality is of absolute major importance. New technical features like rhythm check also may help to reduce false positive activities. And of course, a reliable remote monitoring helps to reduce the false positive detection and then reduce the workload. Second, sensing quality expands your indication. Mainly P-wave algorithms are necessary to improve your diagnosis. Third, individualized programming also may further reduce false positive detection. And finally, using a patient app for symptom ECG correlation might improve your therapy and diagnosis in patients with loop recorders. Thank you very much.